indivisible, with liberty and justice for all. Okay, we've been presented with the agenda for tonight. Can I have a motion to approve the agenda? So moved. Thank you. Is there a second?
Second.
Okay. Been moved and seconded to approve the agenda. All those in favor, please signify by saying aye.
Aye.
All those opposed? Any abstentions? Agenda is approved. First item of business tonight, or the only item of business, is item D, consider approval of offering teaching contracts for the 2021-2022 school year to Cody Grant as a special education teacher at Thornton High School, and to Amy Schmick.
Sorry.
Can we spell that right in the minutes? As an elementary teacher at Lincoln Elementary. Can I have a motion, please?
Move to approve.
Thank you. Is there a second?
Second.
Thank you. Any discussion? Okay, hearing none, all those in favor of approval of offering teaching contracts to Cody Grant and to Amy Schmick for the 2021-2022 school year, please signify by saying aye.
Aye.
All those opposed? Any abstentions?
Aye.
The motion passes with one abstention. Okay, we will now move into the work session. The tables have been set out front so we can kind of, visit with each other as opposed to looking online or whatever. So let's just, instead of recessing, let's go ahead and move out to the tables and we'll begin our discussion. Okay, so the work session tonight is, at least my intention was to discuss kind of what sort of things we're going to look at that's going to trigger any sort of decision to move between tiers within the Smart Start plan. So with that, I know there's been some concerns about kind of where we're at now, so I guess let's just begin the discussion.
Would it be beneficial for me to just give, so I prepared some slides this evening just because to show current data from the state. I just pulled it off the state just so you guys can kind of see trends in Goshen County. Would that be helpful to share?
I think so.
Do you have those?
I'll get connected here in a minute. My computer is going quickest this evening, of course. But once I get connected, I'll put that up there. It's always an encouraging screen.
There you go. That's
White
good
blank
for everybody,
screen
isn't it?
is fantastic.
I think
Then
that
it's
should be
just-
a good place to start.
Brian, if Zach sends the PowerPoint to you, could you put that up there? I may
Yes.
get into it, it may beat you, but just in case.
All right, you should have it anytime.
I'm connecting, so probably about the time you're ready, I'm gonna be able to do it. I got it, Brian.
Start at first.
Yep.
Maybe
Mhm.
it just likes that the best.
Mhm. That was the one I stopped on. Brian, do you have it open? Keep working on yours open. I know to change slides.
Yeah. I'll send it to Lorraine and then she can just, or I can send it to you as well right now. And maybe then- Gmail. The
Yeah,
Gmail.
yeah.
Sorry about that. Yeah. I think it's fine. I just, so you can just send it to all members of the board while you're. So I'll give you some background of why these slides were prepared. I updated them today. On Tuesday, myself and Eric Foley, who is actually the Hospital Association CEO, met, and Tim Thornell, who's the CEO of Cheyenne Regional, met with Governor Gordon and his policy team to give an overview. And so I just thought the same data was really pertinent for this group to see. Dr. Harris was involved in that meeting as well. So the next slide, please. So what we're seeing right now and why we're seeing a surge in COVID, we all hoped it would be over in many instances, but this is what's happening is we have this Delta variant. So that original virus back in 2020, January of 2020, was the original virus in the Wuhan province of China. If one person infected about 2.4 to 2.6 people, so it's not extremely contagious enough to be worried about, but not super contagious. The next version in Europe then impacted about 3 people for every 1 person infected. The primary strain that we saw through that, and you'll see the bump in the trend line in November through January of this year, was Alpha variant. And that variant, 1 person, went on to affect 4 to 5. Delta is 5 to 8 per 1. And so that's why we're seeing this increasing trend. And I'll kind of explain some of that here in just a second. So it has similar transmission to chickenpox. And so it's infected person is shedding higher amounts of virus than the previous variant. So they're just more infectious. It's 2 to 3 times more contagious. And then the ongoing high transmission equals a greater risk of even more contagious variants. So that being said, one of the primary mechanisms, and in talking with Dr. Church, his of our county, next slide, please. Of course, is vaccination. We all wanted this vaccine to come out. Unfortunately, in Goshen County, we have about 30%. You'll see there, partially, I don't know, you can find us there. So first column is the entire population. Second column is adolescents. So you can see our adolescent population is about 12% vaccinated in Goshen County. The highest, of course, is in Teton County, followed by Albany County. That's probably to be expected if you have lived in the state any amount of time. Goshen County, then, adults 18 plus are about 38 to 40%. And then seniors are the highest portion of the population vaccinated here. They're just over 50% vaccine. So that's good because it's preventing morbidity and mortality. So people that have the vaccine, we're still seeing some breakthrough cases. The data we were presented today, and I did not include that slide, I apologize, but a significant portion of the patients that are getting COVID after a vaccine, they're not getting nearly as sick. So Taylor was at that same presentation today. He might actually have those numbers.
Yeah, so this is hospitalizations and vaccinations within all of the banner hospitals in Arizona, which that's where we're primarily located. Out of 620 hospitalized, 558 were unvaccinated, 62 were vaccinated. 207 of those people ended up in the ICU, 188 of them were unvaccinated, 19 were vaccinated on a vent, 104 were unvaccinated, and 13 were vaccinated.
So you can see the proportions there are very much, so we're preventing the most severe illness with vaccine. So the next slide there. To kind of look at what we're experiencing here then is this, this is what they call 14-day rolling positivity. So of the tests taken, how many of them are positive in Goshen County? This number, if you look at other small counties like Goshen County across the state, this number is very small. However, if you look at our own at the hospital, so tests we perform, we're at about 28% positivity this week. The reason why this number looks at 5% is because they test half the prison's population every week. And so we have a huge N size of controlled people, it's controlled people going in and out. So if you look at Platte County, theirs is upwards of 15, 16%. And like I said, our own testing done at the hospital is around 28% this week, positivity.
I got a quick question, Zach, on this. Is that average, is that only through Banner or is that
So
through the county health?
So this one right here is everybody that did a test in Goshen County that was reported to the state. So if you ordered a test through public health and did it at home, if you had it done at the Cowboy Clinic within Banner, the prisons, the nursing homes, etc., all of that testing is in this data. So that's what I was saying. Banner's testing this week is at 28%, not the 5% that you're seeing here.
So has anybody ever done an average on how accurate the tests are at Banner compared to the ones you can order off the internet?
So our test is about 95 to 97% accurate. It just, so yes, the reason why the variation here is not, again, it's not because the tests we're using are different. It's because of the controlled population. They're doing institutional testing. So those inmates aren't exposed in the community. So what we typically see is the prison volumes lag the community by about 3 to 5 weeks. As guards become sick and infect inmates in the prison, you'll start to see that peak as well. So we've not seen that yet at the prison. That answer the question?
Yeah, basically, in your opinion, how accurate are the at-home tests compared to the hospital?
So at-home tests are varied accuracy, and it's not necessarily because the test itself isn't accurate, it's because of how people administer it. If it's a saliva test and they just drink a 32-ounce Diet Coke, it's gonna have less virus in their mouth because they've washed it all, and so they give specific instructions of don't eat or drink for a certain period of time before you take the test. So if it's not followed appropriately, that's where you receive variation in test results. So the next slide then, what does this mean across the state? You'll see a similar ramp up. The state, this is hospitalization. And so you can see today, it's a near vertical line the last 3 days with 3 to 5 days actually. So we're at 174 hospitalizations. The last time that number was seen for COVID was around December 15th of 2020. And so during the ramp up, as before that peak, it was in close October, November timeframe. So the next slide then just shows on the left-hand graph there, that's the 30-day change in hospitalizations. So you can see we more than doubled hospitalizations. The concerning thing for this board to kind of look at, you can see how much volume is in various hospitals. Ours shows 2. When I left the hospital today, there's 6 today. And so, but the concern here, and it's not highlighted, I didn't go pull Colorado data, but is Children's Hospital of Colorado was on the same call Tuesday with the governor, and they're seeing, what we're seeing is co-contaminant infections of RSV, which usually happens in late winter, and COVID and croup. So we're seeing all of this together. The respiratory system, the respiratory season has started in August, where it typically starts in October, November, when it gets cold. And so they're at 98% or so bed capacity. That was as of Tuesday. That's why I say as or so. I don't know what it is today. I'm not versed with them. So the next slide then is really getting into Goshen County. So this is all state data to this point. When you look at Goshen County, again, that big bump is the surge that we all seen and felt in November. This is when Southeast had to close for those few days early before Thanksgiving because of how many cases, students, teachers had. And so that's when that big bump occurred. This is called a case rate. And so, and the percent on the bottom here, Goshen County is at about 10%. Platte County has had far more cases than us throughout the earlier part of this year, and they're at about 6 right now. So, and we're ramping up pretty quickly. And again, all of this data, if you ever want to go find it, is under the Wyoming Department of Health COVID-19 data. So you can just go pull it straight from them. And then the next piece there, I actually emailed Dr. Harris today just to say, okay, so what is it actually looking like? And what kind of has me the most concerned is during that last bump in November of last year, we did not see children in our ER. We just didn't. It was older adults and it was older adults, end of life people with lots of comorbidities. In the last week alone, we've seen a really big escalation in young adult infections. So people below the age of 50 having infections, and then we've seen pediatrics in the ER for the first time. And so this right here is showing, so December of 2020, the full month had 11. This data lags a little bit. So because of tests being reported to the state, this is what they pulled as of this morning. August of 2021, we've had 13 in Goshen County total cases. And so you can kind of see that ramp up right there in August. Again, similar to where we were in October, a little higher than we were in October of last year, but not nearly to the November yet. So modeling data that we ran internally would suggest that that trend continues. You can go out and look at IMHS data. If you just Google that, and that will show a similar ramp up in cases across the state. So just a high level overview of kind of what it's looking like across the state for healthcare resources. if you go back to that hospitalization slide 6, why this is even more concerning is we had to transfer out an adult patient that needed ICU care in the last week, and we called 9 states to try to get acceptance. And so I can name them. We called Arizona, Utah, Idaho, Montana, South Dakota, North Dakota, Nebraska, Wyoming, and Colorado. And so to find a bed. And so it was really delayed to get that intensive care bed. So that's what I know.
Okay. Brian, is there a way you can pull up the county Department of Health and go to that count, like the color coded thing?
I got it up already.
Just so we have that available.
Yep, absolutely.
Let's go ahead and go to the second page. So I noticed today that we went from orange to red. You know, when I go back to when I signed the mass variance, you know, these are the statistics that we used in that discussion. And I'm not making a statement one way or another. I'm just saying that's what it was. So I guess for our purposes then, because we're not making a decision tonight on anything, just really to me, it's like a discussion of what are we going to look at to help us make that decision. If we feel like we need to have it, like we discussed at the last meeting, if we feel like we need to make a move between tiers in our Smart Start plan, that will require like another meeting, unfortunately, 24 hours notice. And then we can have that discussion and take that action. So with that, I asked Mr. Kramer, you know, to go from 1A to 1B, what does that entail? What changes would you in summary? Or, yeah.
So we make
And I
copies.
apologize, like I should know that, having looked at it plenty of times. It's been one of those weeks for me where nothing's really sticking in my head.
It's just cleaned up, a little cleaned up version is all. But no, there should not be any changes to it. Also, just to put in, give you a little bit more data and things. You know, we keep pretty close tabs on what our information is. We did start off the year, you know, within the last 2 weeks prior to school starting, there was kind of some, well, we had our first positive case on a campus since June, 2 weeks ago. When we started school then on Tuesday, we had 14 active cases. Those were either students that we knew who had the virus outside of school, obviously because school hadn't started, or staff members from trainings, possibly trainings or other exposure. But out of those 14, we had 11, I believe it was 11 staff in that situation. Since that time, we've had some recoveries. If you did get the email last evening, we did have our first 2 cases of the school year yesterday on the second day. One in Torrington Middle School, one at Lincoln Elementary. So right now we have 12 active cases. Of those 12, 6 are staff and 6 are students. Today we had a attendance absentee rate of about 4.71%, and that is just students that are ill. That does not include students who were excused for activities or they had other events that the parents called in and said they are doing something else. We track just illness alone. And then also we had 57 students in quarantine today. That was, we'd have to go back For active cases, the last time we had that many active cases was the 8th of December last year. And then to have that many in quarantine was the 18th of December, coming off of our highest rate that we had. And we currently, we will add another staff member to the quarantine number. And so we will currently have 4 staff in quarantine in addition to those positive cases. So we have 9 staff total right now that will be not in school related to specifically COVID.
What was the, if you remember, the staff absentee rates or quarantine rates and student rates when we had to move southeast to online only right before Thanksgiving?
Yep, let me go to that. Staff was very at Southeast High School. It was about, out of the staff we have there, and I can't remember exact number, but we were almost 80% of the staff were out due to quarantine or positive cases. Student absentee rate, I can find here momentarily. That would have been, we know the date that would have been possibly. Was that?
November 20th.
Okay. On November 20th of last year, we had a 19% number of absentee. So the percentage was 19% absent. And then we had over 220 students in quarantine at that time on the 20th of November.
Okay, I guess I think I remember this, but I think just for purposes of our discussion, really the main driver why we did what we did with Southeast was because of the staff number. We couldn't adequately provide either enough substitutes or whatever to cover the areas that they needed covered.
Exactly. And what's kind of interesting with that data, just prior to that 20th, about 2 weeks on the 4th, we had pretty much a mere number of what we have now. On the 4th of November, we had a little bit a higher absent percentage due to illness, about 7%. But during that time, we had 53 in quarantine. And in that 2-week period, we jumped up just almost a vertical line during that time. And then following Thanksgiving, it was a slow downward trend from there. And we didn't seem to have the impact. Christmas vacation helped us significantly in relation to school spread because there was that bump in January community-wise that we didn't necessarily experience as significantly as the community infection rate rose.
So, Mr. Kermit, you and I kind of had this discussion too. One of the main differences between 1A and 1B is the screening. Is that at least, is that just in the extracurriculars?
That's correct. There's pieces to the visitors that change slightly. There's not significant changes in that 1B as we changed. Also, facilities are changed a little bit higher expectations on the cleaning. And then there's some that aren't necessarily referenced in here that don't exist because there's the transfer zone piece. We do not have the transfer zone for buses any longer. But it has just a few things throughout there, as you can kind of see as you compare 1A and 1B, that steps up the frequency and the initiation of some of the things that we're not allowing as many groups in, we're not allowing as many individuals into the building, those types of things. Staggered dismissal times is another one.
One thing that I'm seeing here too, and I don't mean to focus just on extracurriculars, but I know that that's going to be a concern probably. So last year, when all this was going on, we had, various methods of allowing people in to watch football games, volleyball games, what have you. But that was because there was a state health order that was limiting the amount of people we could allow in. So as I read through that section here, really, it seems to me that all that is driven by something that is that's not in place right now. So we wouldn't really see any restrictions there.
No, we would be setting our own on whatever we see fit, yeah. Probably the most challenging for me over the last, and really in the last day, due to our most recent positive cases that we had, we're seeing situations where there may be some times in which judgment is lacking in regards to staff, parents, students making decisions that certainly impact the number of quarantines that we have, either by attending school while awaiting a test result, or either knowingly or a misunderstanding in regards to when students are not in quarantine and are attending school, a hesitation to go get children or adults tested, even though they're ill, and then having it serious enough where ER visits are needed. That is probably the most concerning, and I really tried at this morning's address on the radio. If at all, as a staff member or student, there are any indications that it could be COVID related, that could happen. It could absolutely affect an entire grade level. It can affect an entire school building. And those things are just extremely important. And especially too, when you're ever awaiting test results, please do not have students attend school, because you just don't know for certain what that test result may be. And it does immediately results in quarantines that affect those situations. And we have the challenge too, where people are refusing, doctors are recommending they get tested and they are refusing, and then not being honest to their supervisor when they're asked that question. And that in turn can cause a lot of anxiety and a lot of stress, because quite honestly, I cannot sit here and say that I'm providing a safe environment for kids right now. Because there are too many variables out there that are affected by what we send and how we're sending kids, and some of the choices being made by parents or staff in those situations. And unfortunately, the large 99%, 98% of people are doing the right things unequivocally, all of our staff. But we do have a small percentage that are making choices that are risking the safety of our students. And some of our staff have been very, very impacted medically right now. And I can say, in last year we had 120 cases last year. I can think of a handful, maybe, that ended up hospitalized. I can tell you out of the 16 cases that we've had within the last 2 weeks, that percentage is about 25% have had a hospital visit. That is a really scary statistic for us. Fortunately, the impact on students has not been yet, because we've been in school for 2 days. But I am concerned as we continue to increase the number of days that we are present in school, the potential impact for that. And after yesterday, I was extremely worried on what direction to go, but I'm honestly, I was sitting at our training last night, Wyoming School Board Association, and hope is not a strategy. And that's honestly for the last 2.5 weeks. That's what I've been doing. And I don't know a better one. I honestly don't. But I can tell you hope right now is not a strategy that I am feeling very good about on a daily basis.
And nobody last night really had a good strategy either in the discussions I had,
So I'll just use a quick example of last week also. Anybody's welcome to explain or help me as a parent understand and grow confidence in our whole protocol on all of everything COVID related. With the football-ish kids that were, one kid came in, and Ryan, you interrupt me and help me in part of the steps. So we had one positive case. Somehow it wasn't, he just said he had a positive test, right?
Well, and that's where it gets really challenging. So in some instances, what we found is there are two different tests out there. There are the antigen, there's a rapid antigen test. And Zach, correct me if I'm wrong, the antigen rapid is about 93% accurate. Having a false negative is more likely with an antigen rapid test. A PCR test is another test that our PCR saliva test. Is that the best description of it, Zach?
So both the nasal swabs and saliva, you can run PCR of a variety of fluids, but yes.
Okay, so that one was sent into the state lab. So the situation that we were seeing last week was we had a individual two tests, a rapid antigen test that came back immediately as negative. The PCR test was sent to the state that take 24 to 48 hour turnaround on that, came back and was positive. The process that the state has used 100% of the time that I'm aware of is if you have two PCR tests or two tests, the PCR test is the most accurate. So they always take the PCR test. In this situation, when one of the individuals that I have not had an opportunity to work with at the Wyoming Department of Health was contacted and asked a question, what do we do in this situation? Their answer was get a third test. So in that meantime, between having a third test, having that PCR test, we found out we had a positive case about 15 minutes before practice occurred. So I went immediately to the coach, asked the coach, okay, we need your practice plans. We need to figure out who could potentially have been close contacts, because there's no way in regards to this that we can have a regular practice coming up with knowingly having this positive case. So we then took those names, informed those individuals that we are going to have your names sent to the Wyoming Department of Health, or any county health is who I usually contact, and provide those name and contact information, and they'll be in touch with you soon in regards to this. So that was the afternoon. The next day then, county health starts contacting those individuals. In the meantime, we had a third test be taken. Third test comes back, that was a rapid PCR test, comes back negative. I spoke individually to the person at the Wyoming Department of Health, asked them, this is what we have. I see the results of this test. You have these other tests that you are aware of. And they then removed that student out of isolation and said, two negatives, trumped the one positive.
So we had 3 tests, 2 of them were negative, 1 was positive.
Correct.
So 66% was inaccurate, either way you look at it. 60, yeah, 3 tests.
Yeah.
2 out of 3 were negative,
Mhm.
1 was positive.
Mhm.
I'm just. Yeah. It's just hard for me to put faith in all the numbers when the information is like that. I mean, it's. Especially when I agree with everything that happened, right at the start. That was the safest thing we could have done is inform all the kids on, the positive case, but in actuality, it wasn't positive. So I don't know how can we communicate saying it's confirmed positive when it turns out not to be. That's all I was trying to get at earlier on some emails was if we're going to go out publicly and say it's a positive case, and it better well be a positive case, especially when we're going to talk about quarantining students and teachers. So how do we double check when I come in with a spit test to you and say my kid has COVID? Now you have you have to quarantine a whole class. Are we doing anything extra to confirm that this test I just bought over the internet is accurate or not?
And really, what we do on any situation where a parent contacts us directly, we're immediately calling county health, asking them, can you confirm this positive test? More often than not, I can say I can't think of a situation in this last year where they've told us it's been a positive case where it actually hasn't been. At least we have the paperwork to back it up. This situation that we had last week, that was a new one to me, that I had never had a situation either where they recommended a 3rd test. And so that was kind of a surprise in that situation because as I had been told numerous times, and I know our county officials have been told numerous times from the state, that the PCR test is the most accurate, is the best situation for finding that. It is, Zach, you can probably answer better on that data and information on the accuracy of tests than I probably can, but I think that was a pretty big anomaly in that situation from what I've understood, at least experienced.
So the second test that he came back negative with was not a PCR.
It was.
It was, okay.
Yes, the 3rd test.
The third
The
test.
3rd test was
a
a
PCR.
rapid PCR.
Okay,
So there was and that's the other interesting piece is the one that I would have expected to be inaccurate and a false negative would be the rapid antigen.
Yeah.
Because 93%, I mean, it's still 93%, but they have there's a larger tendency for false negatives. And a PCR saliva-based test going and being sent to the state has typically been very accurate in this situation. A 3rd PCR test that was rapid indicated the negative.
Does the school district have, I don't even know how to word it, but like a written protocol, quarantine protocol between the school district and the county health department?
We have, you mean process for ways that we,
Like if I came in and said, here's my test, or, do we have written protocol steps on this is what we do next, this is who does what, this is what the county health officials do, this is what we do as administrators?
there is not a written one. What has been done is the principal usually contacts me immediately. I contact county health, let them know, here's the situation that we've heard. Can you confirm this? What do you need? And in many of the cases, just like yesterday, We had two different situations, two different buildings. One county health official came to the school and sat in a room much like this with the instructors and the administration, went over seating charts, went over everything together. In another situation, in the other school, we electronically gave the seating charts and information, and then information that was reviewed via the video that we have because of lunch. And we don't necessarily have a set lunch seating chart at those lower grade levels. And so they reviewed video of that, reviewed video of the hallways and those, trying to get the most accurate information possible. Because again, you're dealing with 15 minutes over a 24-hour period, that it would be much more simpler if it was 15 minutes and then it is. But unfortunately, you have to add now the 3 minutes that we've been together, and then I go over here for 3 minutes and add those, and I come back, and if it's cumulative 15 minutes, then it's that quarantine piece.
So ultimately, it's county health that determines the quarantine, who's quarantined, who's not.
They will ask us questions. If they are unsure, we will provide them any and all information related to what we have the best estimate on. The ones that are probably, they're much more dependent on us is for those lower elementary, because those kids, they would have no idea. It's struggled for an adult to know. In a practice situation, it's the coach. The coach has the most information because we asked them to keep practice plans. They knew the list of things. And even then, the county health official, when they're making calls, still could get a question, and they might call us back. And that's happened a couple of times. Are you sure this person is correct, that they were in fact there? We go back, check the list, go back and check the information, check the attendance, because there was one situation in this that, because there were 2 days of exposure. That's what makes it even more challenging on the first situation. Monday and Tuesday were exposure. So we had to look at both of those dates. And then if a student was absent on Tuesday, they weren't exposed on Tuesday, but they were exposed on Monday. And it was a situation where, the individual was exposed on Monday, so that's why they were on the list, but their quarantine starts differently because it starts from Monday rather than Tuesday with everybody else.
So if they were together for 14 minutes and then were apart for 24 hours, basically they would not be quarantined. Is that correct?
So
Go ahead, Zach. you
No.
probably-
that was my hope, right? I called Alexa Harris and asked just that. So why don't we just rotate students around every 15 minutes so they're not ever by anybody for longer? And the CDC is very clear on their website. She sent me the reference. It's cumulative time. And so if I'm sitting here next to Mark in first period for 7 minutes, and then I'm next to Mark not until 8th period, but for another 8 minutes, that would be a 15-minute period.
But
So
that's still within the 24-hour time.
correct,
period.
in that 24-hour time, it's just
Right.
cumulative in that 24-hour
Right. So,
time.
but if it was only 14 minutes in that 24-hour time period, they would not be quarantined. Am I correct?
That's the way the CDC has the
Exactly.
guideline right now, the State
Okay.
Department of Health, yes.
So, yeah, if it's 14 minutes on Monday and 15 minutes on Tuesday, start from that different day.
My
This
understanding
is
of how
what we
they
get
were
to.
doing last year was different.
So why was there a high number of quarantines last year when we, with masks and everything? I thought that was to eliminate the quarantines.
So a lot of those were community-based ones
Yes.
in regards to families and when they were outside of school. We had a really small number that were actually based out of students. There were a number of situations where we had medical reasons for a number of our students that had exceptions, which is absolutely acceptable. But then that also, if we had a positive in that situation, did result in some quarantines in the school. There were not many of those, but when they did occur, there were some quarantines. But primarily, the majority of the quarantines that we saw before were from community experiences, from family, and all of those things.
Which brings to the question in my mind of, okay, right now there's not a mask mandate in Goshen County. There's not a statewide mask mandate. we can mask kids at school, but ultimately, they're gonna go home, they're gonna play with their kids, they're gonna be in the community, they're gonna be doing extracurricular stuff outside of school. That's a, I don't know how you get around that. That's, right now, it's impossible.
So help me understand, I guess, then last year, in the quarantine situations, and keeping in mind that last year we had, we were for the most part masked up. So you had presented something where you had a block of 9 squares, the one in the middle tested positive. And regardless of mask or not, the 8 around them also had to quarantine. So, and granted, my exchange with Dr. Church last year at the variance meeting was awkward at best when I tried to pin him on how that was going to work. So when we talked about taking the masks off, so in that same situation, if the person that tests positive wasn't wearing a mask and the 8 around them, even they were, is it the same, or does the quarantine extend more when the person who tests positive wasn't wearing a mask?
So do you have that slide?
That's what I was just getting at.
Because my understanding from what you sent was it almost is quarantine is not dependent on masks.
It's dependent on the source wearing the mask is what it's dependent on.
Okay.
So it's either, so it doesn't help. So the thing that we've spoken about is you have the freedom to wear a mask, which will prevent you from quarantining. That's not what, or help you from not getting ill. That is not what the State Department of Health is saying. That is the exact opposite of what the Department of Health is saying. So I spent an ungodly amount of time on the phone trying to figure this all out last week, but that is the, because my understanding was masks, you're fine. It's the source. So if you, in this situation, you and I, you're sick, I have to quarantine. I'm sick, you don't have a mask on, you still have to quarantine. But if we both have masks on, you don't have to quarantine.
And Mac, to your point, I think a lot of our parents last year were really careful with their social interactions and socialized only with people who they knew were taking precautions in order to avoid becoming infected. And a good portion of our parents chose otherwise.
So but that's not gonna change now. I mean, now they're not. I mean, we're seeing that, what I'm saying is maybe they were careful last year in that situation, but right now, this year, we could mask the kids at school, but are we still on a local level? We also had a Goshen County mask mandate. We had a state mask mandate. We had a bunch of things in place at that time. Those are no longer in place anymore after they get out of school. So what is making these parents make that decision to be careful? Maybe it's their own recognizance, which it was then too, but there's less incentive for them to do that now than there was then.
But as a board member, I feel really responsible for ensuring that kids are as safe as they can be in our buildings. And what goes on outside our buildings, I can't control.
Right.
But
you're making my point, Catherine.
well, I know, but we can't control what.
I understand that. And that's what I'm saying.
I think it comes down for me is if, God forbid, we have a staff member or a child die, which this Delta variant is a real possibility. I want to know that I've done everything possible to maintain the safety of the children and the staff. That includes masks and includes social distancing. And if we have not done that, those deaths are on us. That's just the way I feel.
I got a question for everybody kind of on that topic. I was really hoping we wouldn't go there, but anyway. My biggest thing on all of it is as a school board member and a member of our community, do we feel that we're in a position to mandate health decisions for the families in our district against their will? Do we think it's our right to tell somebody what to do with their body against their will?
We already do that.
What's that?
We already do that. We do that with other vaccinations.
No, do you?
Do I what?
Do we, as a school board? We don't mandate anybody.
We mandate
doctors do.
vaccinations.
No,
we don't.
we don't.
Well, no, we don't, but they're still
doctors do.
mandated.
Right, but we don't. Us 9 right here don't. We don't make that decision because we're not qualified to. We're not the doctors. We're not making up the laws. We're not administering the vaccines. So explain, just on a human right. I do not feel anywhere, shape, or form that I have the right to tell Mac what to do with his body. Anytime. And by mandating masks, that's what you're doing. It might not be to you, but it is to me. And it is to a very large portion of our community.
But it's,
If you don't think I'm right, then give everybody in the school a vote on that exact topic and see what it is.
it's our responsibility to provide the safest environment we can.
Right, but
Might
is
be
it
our
up to
responsibility.
us? Is it up to us to determine what's safe for each other?
Well, we take asbestos out of the building.
That's a law.
Well,
What I'm gonna say to that is your right ends where my right begins. And my right to safety, my kids' right to safety, that's where it lies. So when you're saying here, when you're sitting here saying, well, you can't tell because that's my right, well, you're absolutely right. I can't tell you. But my right starts where your right ends, and that's where that is. I'm trying to keep kids safe. And when we're saying, let's bring all the people in here, no, that's why we're voted into this position. We are voted into this position because there are people who have confidence in us to be able to actually make decisions that keep kids and teachers and families safe in our community.
So
That's again, no, you're fine. Go ahead.
I was just thinking, I mean, we can go back and forth against some 9 of us all day long. We're never gonna agree on it. It's plain and simple. My thing is, what if you gave every student and every staff member in our district a vote? Would you stick behind the outcome of that?
No,
So
I would
no.
go with the data.
So
The data
everybody in the
shows that
community's vote
masks-
doesn't count.
The data shows that masks do mitigate this disease.
So you're
That's the
saying
data.
everybody's own interpretation of the data is wrong.
No, I'm saying the data is correct. I don't interpret the data. The data is the data.
But it's not up to us to take people's rights or freedoms from them either. If it's your choice whether your kid wears a mask or not. It's not up to us to sit here and make that decision if that's what to do. It's just not. That's not our job as a board.
but we've been
So-
told, throughout our education that with rights come responsibilities. And we have responsibilities that go with those rights. And everybody's responsibility is not to make somebody sitting next to them ill with a potentially deadly disease.
That's exactly right. But then if you're sick, then you probably need to stay home.
But that's not happening. is what
But that's
you're saying.
not up to us.
That's not our problem.
We can't, there's nothing we can do about that.
But it is
Our
our problem
rights as a
because they're
school
coming
board
to
member,
school.
our rights as a school board member and our job is to take what everybody in this community, that's why they voted for us.
But
So we can't sit here and say, everybody out in this community, we're smarter. We have way more knowledge than you do. We don't care what you choose, unmask or not. We have the knowledge, you don't.
absolutely
You're
not.
gonna wear
And I
masks.
guess the thing is what we're saying is within our boundaries of the school, which he's responsible for, and we're responsible for. We're not saying in your house you do this. We're not saying within that community you do this. We're saying within our building, within our buildings, this is what we're expecting everyone to do to keep kids, families, teachers safe. We're not telling you what to do in your household. We're saying within our buildings, this is what we're doing. You're absolutely right. Can we actually say to people outside of the walls, to wear a mask? Absolutely. We cannot. However, when you bring your child in within our walls, which we're responsible for, this is what we're expecting.
And I just, it's been an interesting year. And I think that this has become a really divisive topic. So there's 2 points that I'd like to just call out. One is, not only does this board have the need to keep kids safe, but we have a fiduciary. Our primary goal is to educate kids, right? It's written up there what we're supposed to be doing, our mission, what we're supposed to be doing. We also have a fiduciary responsibility to the district. And unfortunately, we don't know the outcome of a number of cases that are being tried across the nation right now on this topic. However, to your point, Dylan, or Trustee Hager, sorry, when we're talking about the people making the decisions and understanding and going by their guidance, what we're being told is the American Academy of Pediatrics, the CDC, the Wyoming Department of Health have all said at this point in time, you should be wearing masks indoors because of rampant transmission. And so the question that I have is twofold. One, are we doing what we can by disregarding the experts? Again, we just, to that point, and I agree with you, none of us in here are that. But if they're all telling us to do this, even the governor this week said, this is for schools, I would encourage it, or I support it. I'm not going to challenge it, but this is for schools to decide. But if we're disregarding the experts, right, to that point, are we doing our duty? Secondarily, to keep kids safe. And then second is if we don't, on the back end, OSHA recently released regulations. I'm not even sure if the district's reviewed them yet around creating a safe workplace, but are we creating a safe workplace for our teachers and our students? And there's case law going through Texas right now. I don't know where that'll end up. I don't know more than any of you guys do, right? But it's intriguing. The fiduciary responsibility that we hold is, what is a day of school worth to a parent? What is a day's lost wages worth to that parent? What is a 10-day quarantine worth if it could have been prevented because all 9 students in that box have a mask on? I don't know.
And if it will keep teachers and classes in school.
I think that's the
Rather
primary
than-
objective regardless, right? Is we're all here, we all want that.
We all want them in school.
We all want them on the football field. We all want them on the volleyball court. We all want them in the classroom. We all want them playing tennis and golf and all the other band, all the other things that they do.
I think that's partially where I get lost in this is I almost feel like to a point, you're telling those other 9 students, not necessarily, or 8 students, sorry. You're telling them basically, you're just doing this for a formality in case that one student in the center does get it. We're more worried about that quarantine an entire classroom. I don't think we've seen it yet where one student in a classroom has got it and the whole class has got COVID. That hasn't happened. And I think that's where I was last spring when I voted for the variance, was that it didn't seem fair it felt to me like we were doing it to skate by the quarantine guidelines. And that's what was frustrating to me. And I think that's what's frustrating to a lot of people, is that there's no consistency to it. Kids leave school and they don't have to wear masks anywhere else. They can walk right out, pull their mask off, and it doesn't matter anymore. And I agree. I think we do have a duty to keep them safe within the 4 walls of our buildings. But I also feel like when you're talking about those other 8 students, are we really talking about them getting coronavirus, or are we talking about keeping that class in school? I think that's, and I agree. I talked to Zach about, sorry, trustee Miller about, contacting the state health officer, because I think that those quarantine guidelines are very inconsistent with the lack of a mask mandate. Because basically the government is telling us we'll enforce one side of it, but not the other. And I think that's extraordinarily unfair to students, because you're telling those other 8 students that you're going to pay the price for that one student getting sick, even though you have no symptoms. And that's just where I'm at. I want to keep kids safe. I really do. I mean,
I don't think any one of us in here don't want to keep the kids safe. Let's be serious. That's not a valid argument, I don't think, for anyone.
How many people last year when they quarantined, let's say the kid in the center sick, they quarantine all 8, how many of them tested positively? How many people that were in the quarantine?
And that's probably the most concerning to me right now. And I have one example. I honestly have one example, and that's just recently within the last 2 weeks. And it comes from a training that we held here. I can't 100% link those because it's not a perfect science, but I can tell you, we had a positive case, person sitting immediately next to that person tested positive. Same room, across the room, positive case, person sitting immediately next to them, positive. Room next door shares same ventilation system. 2 other individuals positive. 1 individual who was regularly going in and out of that classroom as a supervisor positive. That probably honestly scares me the most in regards, because I don't know the exact science. I try to read, try to educate myself on these things. We didn't see that last year. We didn't. I mean, Dr. Harris continually on the meeting just Tuesday had said, we didn't see school spread. And that was great. I mean, it was great. We didn't see it last year. But in the one example that I have, it scares the heck out of me. And I'm hoping that we don't see any of that. I'm really, really hoping, because of the things that we've done to social distance in classrooms, because of these 2 recent positive cases and those things, that we won't see that same thing. But only 24 hours later, I don't know, because it took up to Monday, which is just under 2 weeks from that first positive case in that room, to really figure out, yeah, these were all impacted by this.
And it is really hard to compare last year to this year because we're dealing with a mutated virus from last year. It's a different virus than it was last year.
To Taylor's point, though, I think if you ask me to be honest about it, yes, I'm concerned about kids' health because we've seen ER kids in the last week. We didn't see them last fall. Yes, I'm concerned. And the pediatric hospital having a specific meeting to let us all, the people that transfer down there, know that they're full, that's concerning. So that's 1. 2, selfishly, I want to see my kid play an entire football season. You're absolutely right. It's just about as much about him being on the field all year and that whole team not getting quarantined. And 3, and probably the biggest thing is, I saw my children slip in school when they went online in spring of 2020. I saw them do so much better last year. And those 3 things combined are to me are what I'm just mask, no mask. I'm just, to me, it's how do we keep the kids in seats in the classroom?
And this year, we've already had 2 teams have a scare. Granted, it turned out great, and that's fine, but we didn't see that last year.
And I guess the thing is going to a couple of points that both of you guys have said is, well, first of all, I appreciate you all saying, yeah, you're here to keep safe also. That's a commonality we all have, okay? The hard part, I guess, issue that I have is, you're right, the frustration of things being somewhat inconsistent. Unfortunately, we haven't had to deal with this pandemic, so it is gonna be kind of, okay, we gotta build the plane as we're going, right? The hard thing that I have is this. Last year, we did have across the board mandates put into place. We have seen that this was effective to a certain degree because of those mandates. What I have a hard time understanding is now that they're not in place, we have a responsibility. When that safeguard was in place, that was a safe wall. When that's torn down, we have a different virus. We have something that's more contagious, and we've torn down those safeguards. How are we going to keep these kids safe without this stuff? How are we going to keep them safe? If we're committed to that, we're saying that's what we're doing.
Then this won't be the last variant.
How is it that we're keeping them safe when we ripped part of this up?
Why don't we have the mandates?
I'll give you my opinion why we don't have the mandates, but let somebody else answer that question.
We'll say the same thing, because those people are in elected office and they would rather us make that decision. That's why the mandate's not there. When
Elections coming up.
when in a meeting, our elected officials are saying, we're supportive, why don't you do it, right? Like, but that's the concern, is they see the data, they understand, they know, they see that ICU beds are full, they see all the same stuff we do.
But ultimately, they're scared of what their constituents or how they will vote in the next election.
They're afraid of the vote.
Absolutely.
But that's not, but again, then I have to question, are these people really looking after the benefit or the best interest of their constituents? Because that's, I'll say it. You know, when you're looking at the numbers, when we're talking July 14th to the 27th, and we had 182, and what were they now, 6?
Mhm. Something, yeah.
They need to explain to me then what, again, masks, the separation. If they're saying, okay, well, I'm not sure about that stuff, what do you mean? We've just gone from orange to red within a couple of weeks.
And last year, when mask mandates were mandated by the state, almost 2 weeks to the day, numbers started going down throughout Wyoming.
So
It's just simply a mask mandate.
So just so you're all aware, I asked Dr. Harris this question, I believe it was on the call you were on, around quarantines. But I asked her, I said, because what I don't want is a mask on our kids the entire school year. I said, so is there a way to tie it to this? And her recommendation was, if you're in the orange or the red, correct?
She actually she took it to yellow because that is actually the CDC comparison. But she personally said she could see orange still also working. With
So
orange or red.
that if this is reviewed, say on a weekly basis, and if Goshen County is orange or red, you wear masks starting the following Monday until that comes back to yellow or green. And at which point, so it's tied, so it's a defined period, right? We're not gonna put a mask on your kid forever and ever. It's just how that,
I think that's a great compromise.
That's why last week when we were talking about this, that's kind of where my point was going, was to be able to use this as a guide, as we as adults, if we as Goshen County adults, and I'm not, again, I'm talking about the school board, but yes, now I'm actually branching out in the community. If we as Goshen County are saying as adults, we're taking care of business, then we will make sure that the numbers go down. We're going to do everything that we possibly can to make sure that the numbers stay down. Okay. And I guess the thing is if that's the case, then let's gauge our mask mandate, not mandate, I can't say that, but let's mask the use of masks in our school based on what our adults are actually doing and saying. Because if they're saying we'll do what we can to be able to keep safe, whether it's vaccinations, whether it's masks, whether it's 6 foot separation, whatever it is, then let's keep kids safe and let's show them by our numbers going down.
So you're trying to punish them,
Not punish
basically.
them.
No, you are. You're basically saying, that unless you guys follow our rules and
No,
get
no, no,
these,
no, no,
and
no,
get these numbers down in the community, guess what? Your kids are gonna be masked.
no, 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 no.
Am I wrong?
I'm saying if I'm responsible as a responsible adult, then I'm gonna take the responsibility of doing what I have to
Mhm.
in order to be able to actually keep our kids safe in schools. And if I'm keeping myself safe, if I'm staying 6 feet away, and that's, I'm not saying you have to wear a mask, and I'm not saying you have to vaccinate. If at the minimal is you're taking responsibility to stay 6 feet away from a person, if that's what your minimum you're gonna do, and that's keeping people safe, then okay, our numbers are gonna go down and kids don't have to wear a mask. If I'm gonna be irresponsible and I'm just gonna blow all that off, then I have the responsibility as a school board member to keep our kids safe. And while that's happening, if our numbers are gonna go up in Goshen County, then within the schools, I have a responsibility to keep kids safe.
Has anybody ever thought about trying to, on a less firm note? Have we ever thought about trying to do educational something with the students on a less serious mandate note on trying to educate them, like, guys, lay everything out to them. If you guys want to stay in school, if you want to X, Y, Z, this is what you should do and take upon your own self to try and help our community.
Talk to the
Have we
teachers,
done
they do
any
it
of
every
that?
day. The teachers do it every day. They did last year.
I'm talking right now.
I honestly, I would never, right now, I asked the teachers to not talk about anything related to that right now in their classrooms. Political, vaccination, or masks. I asked them to avoid that conversation at all costs because I feel right now the tension in the community and the attack that a teacher would face if they would go against what a parent felt their values were, and that would be not to mask. And I had a teacher share with a kindergarten, a third grade or anything, their personal feelings and then taught that student, they would be a huge target right now. And I guarantee I would be getting a call and you would be getting a call.
That's, I mean, I'll be blunt, that's where I'm at. The
And I'm
longer COVID
okay.
goes on,
And I'm okay for sharing that, but collectively, then the school board needs to say, we will 100% protect that teacher in all the situations, because I know teachers in many cases would like to share their thoughts and safety in relation to that, but it is not.
it's a fine line. It's a real fine
And I
line.
agree. I totally agree, but you can see my point in telling teachers, please don't go there right now.
Yeah.
So what did, I guess, has there been any calls where Dr. Church is kind of, because at least from what I'm hearing, he's saying in the community is, and he kind of said it last year too, was, you know, the best way to avoid some of this stuff is, yeah, wear a mask. And I heard that he said recently here in the last couple of weeks that, yeah, the best way to do it is to get vaccinated. You know, so what is it that, and I'm talking in the broader community, not just in our group, you know, when our public health officer is saying those things, what is it that, like, say the county commissioners are looking at? That's not that they're making their decisions on. Is it the same stuff we're looking at? And what is it that's driving their decision? Because I think it's gonna, at some point, it's gonna have to be a collaborative effort, because whatever it is we do to try and improve the situation. But I mean, I guess I just get lost in, you know, when our public health officer is saying, yeah, you should probably wear a mask, or yeah, you should probably get vaccinated. That's where I get hung up.
I get lost in all of it, just a small real world example last week, what happened. And nothing against Mr. Kramer. I know that 24 hours was probably the most hectic you've had all summer. I can only imagine. And I'm only bringing this up because my son was one of the 24 kids involved in that. So I'll just really quick go through the chain of communication that we received as parents. So to start off, it went basically from the player to Mr. Kramer about he was being positive, then to Mr. Bartlett, then back to the players and to Coach Steinmetz at the same time, then to the Department of Health, then to Mr. Christensen, then back to the Department of Health, and then back to Coach Steinmetz. That's who we had in contact with. Not every one of them, but basically the school, someone associated with the school, and the Wyoming Department of Health were basically saying the other one was responsible for between quarantines, between all this stuff. We got two completely different sides of the story on who is responsible for doing what regarding our kids' quarantine. So as a parent, I'm just, who am I supposed to believe? At the very end, and it wasn't just me, there was a great big handful of parents questioning, does Coach Steinmetz really have the authority to tell the kids to come back to practice or not? And we heard from 6 people before that.
Say that last part real quick again on, because Coach Steinmetz have the authority to call up practice on.
To let the kids come back to
Gotcha.
practice,
Gotcha.
you know, because it came
Yep. I
between
understand.
Christensen, you,
Yep.
Gabe.
I got you.
It would, I'm just saying, it would be nice to have whoever starts off the communication should end it. Just some sort of protocol in there, so it's not, parents ain't wondering who the heck knows what they're talking about.
I guess I would assume that if Steinmetz called them back to practice, he had had permission to do so. I trust the fact that he had had permission to do that, so that's what he did.
Well, and I think you're spot on. It actually, I think it should have come from our office on that final one. The ease, why it didn't is the ease of Coach Steinmetz's, we're out on the field, getting practice done with the ones that we had available. And we want to get the other kids who got released as soon as possible that information. And he had his phone with him.
Oh, yeah.
But you're spot on. In what should have happened, the final information should have came from central office because that's where it started.
Well, I do like the idea of going with something like this and a week by week basis, because who wants to wear a mask? Nobody. I don't want to wear a mask. Nobody does. So at least that would give parents that they would know that it is not a year-long process. We're looking at the data every week. We are checking it and making sure it's safe, and then we will adjust as needed, either up or down.
That would just keep some, I guess, consistency within that as far as the community. We wouldn't have to have necessarily a special meeting to change it necessarily, I guess.
Well, if we move to tiers, we would.
Yeah. But I guess, again, it gives a gauge as to what the community and.
So with this would be a standalone thing outside of the Smart Start plan, because essentially we wouldn't be moving tiers. We'd have to have a vote to move tiers, but this would be a totally.
Well, okay, so the way I guess what I'm hearing is this is a gauge we can use to decide whether we need to move between tiers or not. I also am hearing that this is a gauge we can use if we need to have a further discussion about masks. And if that happens to, or if that needs to happen at the same meeting, then so be it, I guess. You know?
So it's a gauge, or is it, we're gonna set it as when we're in the red, so that the community knows. And I
Sure.
think that's what Carlos is trying.
Yeah. I think that gives a good indication to the community. I mean, right now, red is 202 cases. 202 through 999 cases is red. So if we drop to 200, then we drop to orange. Then we could, we put the gauge as to the mask mandate. I think orange, they still recommend the masks. Is that correct?
CDC in their comparison recommends it at yellow. In Zach's conversation with Dr. Harris, she said she can see setting it along those lines, whichever we feel is and I think one of the key things there is Zach pointed out, your local areas are a little unique because of our local, the prison testing. This indication right here is typically lagging. Is that what you put it?
Yes.
2 to 3 weeks behind the other indicators. So I think really the board could choose orange, it could choose red, it could choose dark red, it could choose yellow. Whatever is, those situations are that they feel warrant where we're at.
Where did we start last year? We started at 2.
We started at 1B.
At 1B,
Oh, I'm sorry, Smart Start, yeah. Yeah, we were one.
1B.
And so that's a conversation that I think masks, yes, and we still need to have that. But overall, the concern I hear from parents overall is we don't have what 1B has in there in terms of screening kids before practices, in terms of hand sanitizer when you walk in the door and at every classroom. I think those are things probably we all can agree on. Like, this thing's here. I do think, which requires a special meeting with 24 hours notice. But I do think that moving to 1B at minimum is what should be done. And then, of course, the mask conversation could be less, just because it increases cleaning, it increases hand sanitization, it increases social distancing where possible. And so we're starting to take some of those measures that are just not there at all right now. There's just nothing in place.
The other thing that I would like to see that we did do prior to even COVID was when a student came down to the nurse's office for the flu, we did ask them to wear a mask when they were exhibiting signs. Right now, we don't have that. So if they go down to the nurse's office and they're exhibiting signs of COVID, we are isolating them as much as possible based on the nurse's office. But there is no barrier between them as a possibly infected individual, either contaminating other students coming down for medication, other students who are feeling ill themselves, or staff members coming in to that area. So that is one thing that I think, at even 1A should probably be present. But honestly too, that in this situation, because it's not there, we are not doing that because we feel it's vitally important that you as trustees have that determination on when any mask.
So back to, like when you said you would encourage the teachers not. I mean, what if, if tomorrow someone comes in there, says, I feel like crap. She takes a temperature, has a temperature of 100. Can she say, it's probably best if you put the mask on until you figure out if you're gonna go home?
I have asked nurses not to do that.
No.
But quite honestly, should they? Yeah, absolutely. But based on the climate in our community right now, I do not want to put them on the front lines for that. I do not want them to put themselves in a situation where they will be verbally attacked and other threats being made to them if a parent shows up and their child is in a mask. Because I do feel some people in our community are that passionate about their thought process, and to not have it written and have that documented, I do not feel comfortable making that recommendation to the nurses right now.
I'm just speaking for people in my circle, but I'm 100% against mandatory masks. But if Garrett goes to the nurse and has a 100-degree fever. And he says, and he's telling her, I'm feeling like crap. And she says, Garrett, probably be safest if you put a mask on until your mom gets here. I would have 0. Wouldn't bother me at all.
And
He's sick, he probably shouldn't go to school. I wouldn't even be opposed. Last year when they had, every athlete had to get their temperature checked. Not opposed to that.
That's in 1B.
If you show up and you got a fever, you probably shouldn't be at school.
And I think overwhelmingly, the percentage are right there with you. I would say. There are probably some that don't feel that way. And I've experienced those conversations.
But moving
I
to
would- I would agree
1B
with you.
with that caveat put in there that if there's illness at school, we can amend 1B if we had this emergency meeting to move this, where it says illness at school, that students would be masked. That'd be easy enough to throw in there.
Yes, yeah, absolutely, absolutely.
And I'd suggest once we get beyond the COVID awareness, that should be SOP for all kids going to the nurse. To put a mask on when they leave the classroom and go see the nurse.
Or at least when they get to the nurse's station.
Well, that sends them out in the hall. to
Yeah, I.
Spread their joy.
I
and-
see what you're
Personally, I do think that if we had a universal masking in our classrooms in the red or the dark red, I think just because I watch these numbers so frequently, I think that we would move from yellow to red. I don't see it very often that we would be in an orange zone, right? But if we are on the way up or down, it would provide some time to react. But I think if you're in the red or dark red, those are pretty high transmission levels. Greater than 500 cases per $100,000 population, per 100,000 population in 14 days is pretty high.
I think thinking about what Zach is saying right now is, I obviously don't really like the quarantine guidelines. I don't think they're consistent at all. But I also hate the idea of having all of Lincoln quarantined at once. And I think when you get up to that point, I do think it's worth having a conversation about it, because at the end of the day, you don't want to have how many kids go to Lincoln?
Approximately
Some.
How many?
about 300.
You don't want to have 300 parents be scrambling to find childcare. It wouldn't happen in this community. I think when you look at it from that perspective, and I've seen the kids who come into the ER, it's horrible. And so don't think I'm not coming at it from that perspective also, because it is horrible. But I also think when you look at it from a community standpoint, you do have to consider the fact that when you get up into the really high zones, just like this week, it wouldn't take very much to close down dang near an entire school. And I think, even though I don't like the quarantine guidelines, it's kind of the game we're playing. I think you have to think about it.
And we've had 3 days of school.
Okay, so I guess what I'm hearing is that we're gonna use this as our barometer, our guideline. And it's I think what we've all kind of agreed on here is it's gonna have to be 2 separate discussions about tiers and masks. So, any sort of emergency meeting would have 2 action items. Okay. Is there any other comments on that?
One thing that I think will also need to take place in relation to that, if there is a mass piece, is the enforcement. And what we are to do as administrators in regards to any individual student who would choose not to follow anything. I would want a extensive conversation about exactly what we have expected, because I think in the past, this past year, we used it as, really, it started off as a dress code piece, an exception, and what it became was more of an insubordination, was how it was treated. We tried to handle it not as a discipline matter, but more as, if you're here, you're gonna have to, and if you're not, we're gonna send you home. I would prefer to continue to handle it that way. But I think we need to be very explicit on what the expectations would be in regards to, yes, you've been given a directive and you are not allowed to attend. And I think we would also need to talk specifically about activities and indoor activities in relation to how many times should a person be told and reminded how to wear a face covering. And then on that next time, he asked to vacate the premises.
I agree completely. That's what I had wrote in my notes. I think it would need to be, it'd have to be published somewhere where students can see exactly who gets to tell them how to wear the mask, when to wear it, and what to do.
So
Is it teachers? Is it principals? Is it who? There has to be clear definition of exactly what Mr. Kramer said. And including parents, you're gonna have to do that with parents too. If there's a mask mandate, it needs to be clear to the public on who's gonna tell them to put their mask up when they walk in the gym, what the consequences are gonna be if they don't, and who's gonna enforce them.
when do winter sports start? November?
It is. Yell again. What did you say?
Okay,
That's what I thought. Thank you.
so the good news is the data that would suggest, right, is if you follow a bell-shaped curve across the nation, by the time that those start, we should be well back down. So when you're talking to spectators for basketball and wrestling and all of those things, now, of course, Catherine's crossing her fingers here because I'm hopeful there. So to Dylan's point earlier, I do wonder, this is just, as we're having this discussion, is K-6, which we'd probably have to do K-8 in our schools, because it would be really uncomfortable for a sixth grader, I think, to wear a mask, and then their seventh and eighth grade peers are not. But could you tie, say, K-8, when in the red or the dark red, require masking in those schools? For those others, it's strongly encouraged, and maybe it's just that slide, but teachers, please go over this slide so all of your high school students and middle, are fully educated on the ramification of quarantine if you're not doing it for you and your peers, right? To your point, like, let's educate these kids, let them have some sort of a decision in it. But the other reason why I say that is above 8th grade, there's a vaccine available and they wouldn't have to quarantine anyway if they wanted it. Personal decision. They don't have to get it, but we're doing what we can to protect the youngest. And then with those older kids, educating them on, hey, this is what happens. Transmission levels at this is what could happen. You need to be fully aware. We strongly encourage you to wear a mask in those venues. I don't know. I just am trying to strike a compromise, right? Like, how do you protect those little kids that don't have an opportunity at this point for any other protections, and also allow for the personal freedoms that have been discussed this evening?
That's kind of where I'm at too, especially like high school age kids, anybody. You have the vaccine, so everybody is telling you, go get the vaccine. You don't have to be quarantined. You're going to be safe and you're going to protect other people. So I go out and get the vaccine, and I'm doing all I can to protect myself and other people. I chose to get the vaccine. We mandate masks. So you're still making the student wear the mask and telling him at the same time, you won't have to get quarantined if you get the shot. He already got the shot. And he's still forced to wear the mask, but he won't be forced to quarantine.
Is there a public health that, is it? I didn't know there was a protocol
Yeah,
that if you got the vaccine, you never have to be quarantined.
correct.
That's not
Yeah,
correct,
that's
is it?
self-
That's
it's
correct.
self-monitor.
You have to self-monitor and they recommend you wear a mask for the next
Yeah.
14 days, but you do not have to quarantine.
But it keeps kids in school.
Yep.
Mhm.
So the same thing is there. It keeps kids in school,
It keeps
keeps you
kids in
safe.
school.
Yeah,
So yes, I get your point, but I also have to then throw in where we have to remember what the goal is. And the goal is keep kids in school and keep them safe.
I think we should quit using a goal as to keep kids in school. I think that's horrible. I think our goal should be what it says up there on the wall. We should be committed to be giving our students the highest education possible with the tools we have. Everybody
so-
keeps reverting back to keep them in school. We can keep them in school. We can put masks on them. We can tell them to go get a shot. We can make them walk in a straight line. We can make them not go eat lunch. We can put dividers up. We can do all kinds of crap to keep them in school. But are we providing them with the best education possible?
Well,
There's
from
the
what I
line.
hear, what I've heard all last year, there were some people that were concerned with the education they were getting virtually. So I always heard face-to-face is better.
yes.
And that's across the board for people that didn't want masks and people that wanted masks. Everybody said face-to-face was better. Their education was more qualitative in quality face-to-face.
Face-to-face, yes.
So when we say keeping kids in school, we inherently mean providing the best education possible, at least that's the way I hear it.
That's what I meant, yes.
I agree with that, yes.
And there's data to suggest that face-to-face is not only the best for education, but it's best for their overall well-being. Many of our community can't feed their kids when they're home. Their mental health suffers when they're isolated. A number of those things.
I got a question to Carla. Carla's just super passionate. I think everybody is too, about students' mental health. Just had a thought, what if a student come in to school tomorrow and said, I'm really struggling with all of it. I'm struggling with just not even masks, but say all of it. And say we did mandate the mask. What if they said, I'm super struggling with being forced to wear the mask, struggling with all the chaos of COVID? What's our response? What are we going to say if they come in and say, I hate wearing the mask? I'm super struggling with it.
What would we say?
How
Here's-
would we help them?
You know, and again, I know that you're directing that to me, but it's not about me. And I'm going to be very frank with you. I'm not that mental health professional that would give them any type of mental health in a professional sense advice. Would I be supportive in doing, and that's exactly, and I'm glad you brought that up. Your point is exactly why a couple of months ago, the issue of bringing up, we need to support kids, staff, families, because this weight, the cross that we're bearing is heavy. So do I have the words to be able to actually give you right now what I would tell that student? No. Would I find the right person or would I find the words? Absolutely. But the cross we're bearing right now is a heavy one. And that's why I asked, we need to actually get something in place, not only for the reasons that specifically that I pointed out a couple of months ago, but for this as well.
I agree, because this is heavy
Very.
for kids.
Very.
Can I
And
just-
as adults, we have a responsibility to those kids. And I wouldn't feel good in years to come for my grandkids, my great grandkids to come to me and say, what did you do during that time to be able to actually help out? What did you do? And if I say nothing, I'd have a hard time looking at them in the eye. Because the thing is I have a responsibility as an elected official, as people saying, okay, and I don't want to get on that soapbox, but I have a responsibility to my community to be able to make sure that the kids that we serve and the community we serve are safe. I'm not mandating anybody, what you do out there, that's yours, but within the four walls that you have given us the responsibility of, I have to be responsible. Do I have some guidelines to be able to go with it? Sure. If people are saying, yeah, we can keep it in the green, good for us. I applaud that. Then our kids don't have to wear masks. Simple as that.
So to your point, Mr. Kramer, if you had that kid that came into a counselor's office who is a mental health professional, correct?
Not counselors, yes.
Yes. So licensed counselor come in and they said, you know what? We've evaluated this kid together collegially. We believe that this kid needs an IEP for this specific thing. It could be granted. And we had those last year where certain students didn't wear masks for that purpose. That
There were medical exceptions granted, and it needed to be documented by a medical professional, not necessarily the school counselor, but a medical professional outside of. Yes, we did allow for those. And that actually was one of the things I just wrote down, that would be something, if there was a mask piece put into place, that would be another discussion that we need, because some school districts around the state last year did not allow for any variances. They said, you're either here to wear a mask or we have a virtual instruction option. And so at what point, and then there were those like us that had medical documentation provided with us with a release that we could then have that information and then make that determination. And then there were some that was a little bit different too.
I don't know about Wyoming, but I have seen a couple things, some other states, school districts in other states are doing the same thing on a religious exemption. I don't know if we think about that or not, but
Mr. Kramer, can you check with our attorney?
I actually, in this situation, we could grant. It was because as Tracy Copenhaver allowed, he said in this situation, it is the board's directive. As long as you're providing, you can run the gamut. You can say there is no, yep, exactly. There's no exception whatsoever because you have a virtual option. Or you could offer as many exemptions as you would like. And any array of documentation required, depending upon what you feel would be appropriate for this situation.
So if those exemptions are granted, medical in this instance, so say a medical exemption was granted last year, did they try, again, part of it is avoiding the quarantine. Did they try to make sure that that student was 6 feet away from the remainder of the class so that if they happen to become ill? Okay.
We did try that, in a number of situations.
It's not possible.
It's just not possible. Or if there was a concern too, that the student, again, going back to that other piece, we don't want to put them off into a far corner, excluding them, and feeling separated from the class either. So there's that balance, but that would be another thing, that we need to discuss is, okay, if we grant this medical variance, where should they be seated? Should we then this is the board's directive that they will be seated 6 feet away from any other individual while they're in the classroom? Or will they go and transfer classes at the same time? In some instances, we had the student transfer at a different time because the crossing the hall, without the mask wearing wasn't resulting in quarantines, but the transmission piece was still possible.
And that's a heavy burden to put on teachers,
Absolutely.
knowing which student is, was that one? Yeah. It's a heavy burden to put on teachers who are already doing more than they have done ever in their careers.
So I guess the next question would be, do we need to schedule another meeting? When can we do that? When we say it's 24-hour notice, does that mean from, like, say we decide right now? We have another meeting. Does it have to be at 8 o'clock tomorrow night? Or can it be just tomorrow evening? Or does that-
That's probably tomorrow evening around 7 o'clock is not going to
No,
work
No.
for any.
No,
I was fully aware of that one.
that was a stupid question, I'm sorry. I have a volleyball player, so I forget about football sometimes.
Help me understand why it is that we're.
We can't take action at this meeting. These things we're talking about requires action.
Moving from
But we can.
1A
do an
to 1B,
emergency
is that-
to-
Yes.
Plus
Wouldn't have to be an
masks.
emergency meeting. It would be, have an emergency meeting, take action. That's when you have to have the meeting after that to
Where you,
confirm the action.
okay, so
So you would
It's not a-
typically be calling a special meeting.
So can you end this meeting and call an emergency meeting immediately to follow, to just move to tiers? That's the question.
I would not advise that. I would advise against that.
Special meeting is.
I'm just trying to figure out when we can have it.
I figured I had to agree with it. I think any meeting we have to have, in my opinion, I think everybody agrees here, a public comment period too.
Yes.
I think that is vitally important.
So I guess we're looking at next week then. Well, I am gonna be gone Monday and Tuesday, but I would be happy to zoom in if we saw like we need to do it.
I can't do it Tuesday either.
Next Thursday.
Oh, Monday, right? No, that's, okay.
so if we had this next meeting next week, whenever it gets scheduled, would we be taking action on movement between the tiers and adding the masks, or what would we be taking action?
I guess the way I see it is we would be taking action on moving between tiers. I think action on masks is a separate item since masks are no longer in the Smart Start plan. I think we also at this meeting need to discuss adding the mask piece back in for the nurses station only, since that was discussed tonight. Is that their assessments?
Because that's regardless of tier.
Right, it's not in there now. There has been a concern expressed about
Right.
when a student showing symptoms and goes to the nurses station. Right now, there is no mask requirement. I think we could talk about that separately. At least putting that back into the Smart Start plan for that section only. Having that discussion and taking action on it, whatever comes of that.
I think we should also add, are there any steps that we can do as a school district before 100% mandatory masks? What else can we do? What else can we take action on? What other preventative measures can we assist the students in doing?
That's fair.
I mean, Douglas in Converse County, they're taking temperatures
So I think that's what moving to 1B
at the
does,
door.
right? All of that, start to take temperatures,
Does one B do it when they walk in the door or just at practices?
I think just the practices, but that is one of the main things, like when community members ask is what weren't we doing that last year? Is that why were we not?
But
You know,
isn't that what parents are supposed to be doing at home?
so parents are supposed to,
Parents
yes.
are, yes. Their
I mean,
parents are
it's-
supposed to be doing that at 1A.
Right, I mean, what you're asking teachers to do right now, it's supposed to be the responsibility of parents.
Parents are supposed to do a lot of things at home. They don't. We have to take the response, just like you said,
Yeah.
between our four walls, we have to protect the students.
Exactly.
Okay, so
Yeah,
So if that's something that okay, guess we're gonna get into a conversation of adding things back into the Smart Start plan.
Do we need to recess for 5 minutes?
Yeah, let's recess for 5 minutes and we can come back with that.
guess I'm gonna respectfully disagree. I guess I'm not understanding why it is that, why can't we now? Why, if we're gonna have a meeting, this is a work session, so let's do the work.
We can't take action today.
I'm not saying taking action. If we can't take, if we're gonna set a meeting to take action, we need to have an organized plan to take action. Not have a meeting and then say, okay, now what is it that we're gonna agree upon? That's
I just, because he was proposing something different, so I was just throwing that out there too.
right. But I guess I'm just saying that's why I said I kind of disagree in the sense that if we're gonna have the moving the levels and we're gonna have a meeting for that, I think it needs to be the whole conversation. And again, I can be the lone voice of this.
So you're proposing we vote on masking, everything on Sunday?
Well,
night?
here's the thing. I'm gonna go to a term that was used earlier, okay? When you react, you're reacting without a plan. When you respond, you have a plan. And it's where you're gonna move. You know what needs to happen. I don't want to react. We don't have time to react if we have kids in classrooms that test positive. We don't have time to be able to actually say, okay, now what is it that we're going to do? We should know what we're going to do. That's the difference between a reaction and a response.
So depending on the outcome of that meeting, potentially Monday morning, kids could be masked, everybody could be masked, is that what I'm interpreting?
I think
I'm just
that
asking.
we need to be prudent in the sense that we need to be able to actually get that communication out because that's something that everybody's concerned about. So is it Monday? Maybe not. Is it Tuesday? Maybe if that's enough time to get people that information. But I think that we need to have that plan. We cannot actually, again, we can't react.
Tomorrow's Friday, though. I mean, that's my only.
And I'm not saying it has to be Monday. I mean, don't, I'm not saying that it has to be Monday. I'm saying that as soon as it can be done, okay, let's get it done. I just don't want to, again, back to a term that was used I don't want to kick the can too far down the road when in that road, there might be that bump. I don't think that's prudent.
To that to Carlos's point on trying to be proactive in all of this. Just my opinion only. I don't feel comfortable in any sort of vote on masks before we have a written quarantine protocol between the school and the Department of Health outlining exactly who does what. A written protocol on the enforcement of the masks, like Superintendent Kramer mentioned. And something on either maybe we have to vote on it or ask the lawyer what exemptions we would allow. I think at minimum, we should have that in place before we tell kids they're mandated to put on a mask.
And I wouldn't necessarily disagree with that. What I would say to that is this is a conversation that we should been having months ago, so that when it got to this date, things would have been in place.
I couldn't agree more. We were looking at the last meeting, 2 weeks before school, at whether or not we were going to accept the current Smart Start plan. We should have been dealing with that 2-3 months before that. And that falls on all of us. That everybody's responsible.
You're absolutely right. To be very frank with you, when in May, we should have been saying, okay, what's August going to look like? I mean, but again, building the plane as it goes, we were hoping that we wouldn't be dealing with this.
But you can't run anything by just hoping that. I mean, all I'm saying is we should. I agree with you 100% on that, Carlos. I couldn't agree more.
think there was naive hope on all of our parts, right? That
I think also what I'd like to see is, I'd like to see the conversation finish tonight. So that way we do go into the next meeting with a cohesive plan and aren't hashing out the raw details. I think that, is that what you're kind of saying, Carlos?
Yep.
I mean, if we're gonna talk about what exemptions we want to see, let's have the exemption conversation right now.
Okay,
And if we want to have religious exemptions, I'm not necessarily, I have no issue with religious exemptions, but let's talk about that.
the only question I have with that is who approves it? Who says this religious exemption is legit and who says this religious exemption is not? That's where you get in. You have to have very strict guidelines and protocols on this is what it is.
There ain't nobody that would touch that with a 10-foot pole because you can't, there's no way somebody else could tell the other person sitting next to them that they're something on religious like that, that it's not good enough. We would have to vote on it. I mean, that'd be, unless somebody has another opinion on it, I don't see how you could tell somebody that they have to make that final call. I think that's way too much liability on the school district.
What, is there something in place for current vaccines as far as religious exemption?
There is a form.
Yeah.
There is a form that this is my religious exemption, right?
So when there was a mandate, let me go with this. I just to educate myself on this. When there was a mandate, were there individuals that asked for religious
So we're
exemption?
not I am not aware of any religious exemptions that were applied for.
So last year, nobody approached. So, okay,
There were medical ones.
medical, but
Yes,
not
but they were
religious.
not a religious that I was approached.
And I can understand a medical exemption.
I think to Lynn's point, not that I don't want that option, but I think when it comes to a mask, if that's what we're talking about, an exemption from a potential mask order in our schools, I think you stick with the medical exemption because I honestly don't know who makes the judgment call unless it's just a blanket approval.
It's a medical issue.
medical exemptions were signed by a doctor though.
Correct.
So
They
how
take that
does,
all the time.
sure, so how does, going back to your point, if there's a religious exemption for vaccinations, who signs off on that? You know, or do we know how that process works?
I can bring up the form. I don't believe there's any outside entity that has any distinction. It is a form signed by the parent, and I believe it is only a signature.
One I
It
seen
defeats
from,
the purpose. You might as well just say they're strongly encouraged, right?
one I seen from Nebraska, and some school districts used it. All it said is it was notarized.
That just means that the person who's sitting there was who they said they were.
Is our audio back on? Okay.
Oh. Called back to order. Sorry, Brian.
We have viewers at home, I think.
My apologies to those watching at home for not calling the meeting back to order so we can get the sound back on. All right. So we're still talking about exemptions.
So can I, again, because I wasn't familiar with the process with medical exemptions. So with medical exemptions, were they tested more frequently? They were not?
We did not have a test.
So-
We did not have any requirement for any testing for any student or staff member last year.
So I guess I'm gonna ask. Okay. If a person was medically exempted, or even if they were, when you're talking about, okay, what safeguards can be put in place before they're saying, you know, you have to wear a mask. Do you feel or think that people who would be considering, because of medical exemptions, they'd be okay with being tested?
I don't know about tests, because what, it all depends. I think it's just super big liability for the school district to ever offer testing, COVID testing, and who's gonna perform it. I think they would be okay with like temperature checks.
One thing just, and I don't know if it helps in this conversation. Our school nurses have been providing strep tests for at least 10 years that I'm aware of. And we do have the approval of the state to provide and have had for a number of years to provide those tests.
Okay, so then help me with, when you suggested, what can we as a district do before we put in the universal masking? Can you give me examples of where you're going with that? Because I have my own ideas of what that looks like. Can you give me some ideas of what you're thinking?
Me?
Yeah.
Just-
You were the one that said that, right? Yeah.
I mean, the first thing that comes to mind is, instead of, like, if we're in the red or we're in the orange like we are now, I wouldn't be opposed to kids getting their temperature checked. Just like we did last year, to walk into practice, when we had the mandates, you had to get your temperature checked. If it was over, I don't know what the limit was, but you couldn't come to practice. I think lots of parents would be okay with that rather than before the mandated mask.
Okay, so okay.
Would they be, so same sense as opposed to take it not just for practice, but just coming into the school?
Coming in this building, yeah.
So if a student was exempted medically and they were tested, or excuse me, their temperature was taken every day because they're not wearing a mask.
I think what he's talking about is before we get to the masks, like you check every kid's temperature going into the school. This is
Right.
to keep from
But I'm
getting
just, let's stick just with the medical exemptions or the religious exemptions. Because again, they're gonna be without that safeguard of masks. Okay, and I'm thinking about how we protect them. So I'm asking, if you had students who were, again, because of the exemption, not wearing masks, which is the basic safeguard that we're trying to put in place for students, but because of their exemption, they wouldn't have that safeguard. The minimal safeguard that would be for them would be a temperature check. Because right now, parents are supposed to do it, but we're talking about within our four walls. Do you think they'd be open to having their temperature checked daily?
For me personally, my kids would be.
Okay, so if you checked all the students that were medically or religiously exempted, and then if they had a temperature, going with somewhat of what the Smart Start kind of identifies already. At that point that they have a temperature, as a safeguard, would you think that people would be okay with having them wear a mask until they are tested? Because of the temperature? Because that's one of the major characteristics of, right?
Yeah.
COVID.
Yeah, I mean, I think you should just, plain and simple, like we've always said before, I think if you're sick, you should go home.
What about the
No.
kids who are infected with COVID asymptomatically when they have a normal temperature?
Potentially, yeah.
So you'd have somebody with COVID in school with the regular temperature and no mask.
So I think we're discussing a number of different issues, right? So what I'm hearing is we need to define what our exemptions are, and in our Smart Start, we should probably have universal temperature checking. This in phase 1B potentially is just screen temperatures on arrival to class. That at least takes the sick kids that we know are sick out, limiting exposure.
That's what you talk to.
Well, there's an easy way to do it, and the district has money for it, but it's a matter of if we support it, which is it's a temperature camera. You walk in and all it does is it puts a green square or a green or a red dot above the person walking in. And so somebody has to sit there and watch the one door that everybody funnels in to see, is there any red dot that shows up? If there's a red dot, you go pull that person.
Well, and I think to play the devil's advocate, but as we're seeing right now, I, as the Senate coordinator of TLC when I was there, kids are very honest, and we would come in and check a temp, and I don't have a temp. My mom gave me medicine before I left the house. So we still are going to have those issues where parents are medicating kids to.
So, but that's
they
the
don't have
question, right?
temperature.
Is we can't impact that. So the question is maybe we don't, maybe we just do temperatures in class. And I think that's why it's written the way that it is. It's because it's less onerous on the school. Just test the kids, the athletes, because they're not going to be wearing masks, the vast majority of them. So I think that's probably the best way for it to be written in the Smart Start. But I do think we need to stay, if we're going to get out of here at some point, and to have our work plan is to say, okay, one of our action items to move to 1B. What I'm hearing is there's pretty much consensus amongst this group, we can move to 1B. We can't take action upon that tonight, but that's a good action item. 2, and correct me if I'm wrong, we need to add to illness or sick at all levels of the Smart Start plan. Students wear masks, which is only when they're ill or sick. If they're going to the nurse's station, you put a mask on them if they're sick.
I think we should put a number on, I mean, what temperature do they have to have?
Perfect.
Let the nurse or whoever decide.
Over 100, isn't it?
Did we have that set? We've had that set in regards to what we will send kids home at what temperature. That's in each handbook. One other thing too, along the medical exemptions, each principal created a social distancing plan for any student that was on a medical exemption. So they developed a plan in regards to what that looked like for each individual student, where the seating would be, where they would sit in common areas, where they would sit, or when at what time they would transfer from court classes, or if they were allowed because of their medical exemption, if they felt, yeah, you know what, for 3 minutes, it wasn't a big deal. I could wear a mask and go to class. But then once I got to class, I was able to remove it. So there was a social distancing plan that Mr. Gilchrist reminded me of that they implemented last year also. Just as an example, if that's something that would also be in tune with this.
But to play on your temperature scan, that would be a very easy way for children, but for teachers to check during the day if children had temps.
Yes. The issue that you're going to find with those temperature cameras, they're not. So if the thermal scanners, as they come in, is it's not accurate when we have -10 degree weather. I'll walk in and I have to stand there for 30, maybe a minute and 30 seconds before my temperature registers that it's high enough. Because it's just that cold outside, right? Your forehead, that's where it's measuring it off of, it just cools down.
So maybe when it gets cold, you might have to do it at second period or
Yeah,
something before.
And just to double back, are we talking about all these restrictions just for kids K-8?
so I guess that's the question, right? Is, are we doing a K-8, are we considering having on the agenda K-8 mask mandate with masks highly encouraged in high schools? Or is it a universal?
I still don't know how you can tell a kid he's free from quarantine, he's free from everything if he goes downtown and gets a shot. And yet still make him wear a mask. If that's what we're gonna do, then I think we have to completely change all of our quarantine guidelines.
Well, I think
Or
at
mask
that point,
guidelines.
the mask isn't for him. The mask is for that student possibly passing it on to students who have not had a vaccine. So I don't wear a mask because I'm vaccinated, I'm fully vaccinated. I'm wearing a mask because I don't want my 2-year-old grandson to get it.
That's your choice.
Right,
It's not mine. My choice is not to protect everybody else. If I was gonna want to protect everybody else and I felt that was my God-given right, I would do way more than just wear a stupid mask.
well, I do a lot. I think everybody else does.
So is the K through 8 something that we can, that needs to be part of the discussion we have later, or do we need to hammer that out, right?
Also place it as 2 different agenda items if you'd like.
Like-
One for K-8, one for K-12. It's as an option, if that's something that would be.
The other districts in Wyoming who have instituted this have a K-8 mandate, correct? Albany,
Teton.
Teton.
I know Albany is K-8. I do not know about Teton if they have K-12 or K-8. I believe theirs is K-12. I don't know that for certain.
Albany's,
Albany's, I thought is it K-12?
I think it is K-12.
It was
I
just on
believe-
the radio when I was driving in, but
I can live
I
with
can find
K-8,
out.
at least we're
I think
protecting
K-8.
the most vulnerable.
Yeah. And that would remove a lot of those strictures for athletic practices, contests, et cetera.
I'd say that again.
If we just were doing it K-8, it wouldn't impact, JV and varsity football practices, et cetera.
It's K-8 in Albany School
Is it?
District.
I think WISA, I'm not, and again, I'm not repping, but I think WISA has their own guidelines that need to be followed. But I'm not sure if that includes practices. Do you
Okay.
remember?
They were
Practices, I thought were dictated by. Yeah, I mean, they had them last year. I don't think
They have.
I think when
They did
everybody
away
went away with the state, so did the activity association.
It's
So
pretty
you
much
haven't-
everything just locally.
Did it?
How you want to go do it locally is how you're supposed to do it.
Yeah,
If you're
it was-
visiting, you do it what they want you to do. If you're at home, you do whatever you decide.
Yeah, that's the other kicker is what we decide here that affects us. But when we go someplace else, we have to abide by their rules. Which
Teton is K-12.
But
It's a countywide mandate though.
their rate is really high right now too. Exactly.
So are we just doing K8? Is that kind of what we're getting? Seems like the majority of people are in favor of that.
I think we can put it as an action item. We talked about. It is if we, whatever, we can talk about it from K8 consideration. And then we can talk about the high school separately. That,
And I think as it's listed on our agenda, I think it needs to be tied to red status or above, or according to the Wyoming Department of Health Statistics.
Red status, you said, not,
Orange status or above.
I can put it down as anything. I just want to know what is. And we can always, you can always amend the agenda item or amend the action of the item when it's listed, but as to what is appearing, it's just what I need to know in order to make the agenda accurate.
I think it should be tied to the county health officer's recommendation.
So when they were here the other night, they said yellow, didn't they?
Yeah, Dr. Harris, if she were here, she would say yellow and above.
I believe those guys did.
She said she could get behind. She'll get behind anything, right?
Anything's good.
So maybe it's orange and above.
And one thing to think about, I don't know if this changes it, but thank you, Marcy, is Southeast dynamic is a little bit different as they have a junior high as opposed to a middle school. That doesn't change the format really of what that K8, but just in case you go with the middle school language or junior high language, just remember that we do have a different situation. But going K8 would not, because they have a 9 through 12 high school.
So something else on it, moving tiers, the spectators and stuff for the sporting events, there's a big part of that too. We're only allowing 250 people, except at Willie's Gym where there's an exemption for 400.
that was tied to the state health order.
Right, so it shouldn't be in here at this point. Is that right?
We could, that would be one of those things that we could, as I have listed on the agenda, the number one agenda item would be to modify Smart Start. And that modification one would be the nurse office, but then we could set that or have it unlimited. You know,
Where is that? Sorry.
It is in 1B under
It's on page
facilities.
10 of
Oh,
39.
facilities.
I was reading under athletics, sorry. Yeah, I think that would need to be stricken.
Yeah, because that was tied to state health orders, I thought. I was looking under the extracurricular activities on page 11. That's why I didn't see it. But thank you, Mr. Sessoms.
And that last bullet would have to be removed too.
Second, the third one from the bottom would also be.
Yeah.
Actually, the last three on page 10 of 39 would be removed.
Mhm.
And do we need to put in here that we would lift these restrictions depending on, I mean, if the state would come out again
Well, I think
with
we
those
could,
mandates.
sorry. I think
So,
we could leave that one that says for competition, spectators will follow guidelines. I mean, we don't have any right now, but if they happen to put some in place, then you don't have to change this.
yeah, I think that would be
Sounds
good.
good. These are all things that we can, there are suggestions right now. We'll obviously vote on them later.
What's the third one down? Only coaches and participants are allowed in the facility. Did we talk about that one? Page 10.
So that was actually for outside use for individuals renting the facility. That can be modified, that can be kept, but during, when we were allowing youth practices, at that situation, only coaches and participants were allowed in the facility at that time. That's one me personally, I mean, everybody else can voice it. I don't necessarily know that as of right now, that is necessary. It did mitigate a lot of people coming into the building last winter. And it was placed in there because we were one of the very few districts in the state at that time that were allowing even outside use of our facility. And the reason for that is we don't have a rec center. Our gyms are our rec centers. So we really need to work with our local community to have. And so we were trying to figure out a way to reduce the number of people in the building, but also allow as much use as possible.
To your point, to return to play, this is WISA's recommended guidelines. And they recommend that any active participant who has been diagnosed with COVID cannot return to play until he or she is evaluated by appropriate health care professional and has written clearance by that health care professional to return to play. So, when you're talking about, you need to have some guideline, I guess, to a certain degree, that's kind of what, you can't come back to practice until you're cleared by a professional.
Yeah.
So,
That's the only thing they have in place, though.
well, they have other recommended guidelines. But
I mean, like the football example, when he got the final test results, they sent you a written email on clarifying it, saying that it was negative. That should be minimal.
So back to the K-8 thing. All staff and teachers required, regardless of what grade level they teach, or just the K-8 teachers, or do you draw the line?
Personally, I would think that all district staff would be required to wear them indoors. But that would be,
We can add whatever you guys would support.
I just,
I would support it, need the
if
direction.
they're highly encouraging high school students to wear it, they should probably be leading by that.
I can just visualize. Correct me if I'm wrong. Every teacher in the high school putting on a mask, and all the kids saying, "No mask, buddy."
And I think,
Some will go along with it, but
but you mean students or staff? I'm sorry. Maybe I
no,
misunderstood.
just the disconnect between forcing the teachers and staff to wear it and not the students.
I can tell you enforcement of a teacher is a lot easier than enforcement of a student.
They're getting paid.
Exactly. No, I totally agree with you. But yeah, I mean,
No, I know, I'm just saying, as a teacher,
you're not wrong.
as a teacher, if you're my boss, you're saying you have to wear it, but all these kids around you don't. It isn't the best work environment. I know.
So you just do K-12?
No.
I'm just saying,
Or do you
that's-
do K, another idea to throw out there is, do you do K-8 or K-12 staff, unvaccinated 9 through 12? Masks are not required.
Only staff,
I'm sorry, say it again.
only the staff. So if staff was vaccinated, they didn't have to wear masks, right?
Same as kids.
Based on providing you with the vaccine card.
Right now, and just so everyone's aware, what the requirement is for the public health is that they do, in order to avoid quarantine, have to provide that information to them in relation to
I think, I mean, maybe I'm a stinging doomsdayer, but I'm sorry, but somebody, the longer this goes on, somebody's gonna bring suit to the school district. All these little things we try and say, and I agree, some of them are great ideas and they help protect students and staff, but it's gonna happen. It's all over the country already, so I think that's one thing we should keep in the back of our mind.
I think as Zach mentioned earlier, I think in any direction you go,
Yeah, both sides.
not doing it, possible litigation, doing it, possible litigation. I think you're 100% right.
The bad
The
thing,
only-
when that comes, it's gonna be, I mean,
The only exception to that is those that aren't there to be able to do anything about it. If you know what I mean.
So what are our action items for?
Right
at this-
now-
At this point, where are we
Right
at?
now, I tentatively have, this would be the agenda, would be action item number 1, modifying Smart Start plan. Action number 2, move tiers. Action number 3 would be relating to the color coded information by the county and the mask requirement based on that, which would include the consequences for not wearing a mask, and also then exemptions. And also one thing that I'm kind of taking off that, trustee Hager, and you can have it either way if you would prefer, would be that who, how, and where would be developed in addition to that, but not necessarily part of that action item.
Notifies of quarantine, you mean?
No, we were talking that would be separate, but in addition to that would be because when you first mentioned, who's going to enforce it? How are they supposed to wear it? Where it needs to be worn, those items.
right, I mean, that's what I was mainly concerned on, who, are the teachers? Do they have to enforce it? What if some don't? I think this needs to be clear guidelines and rules, so staff and students know
Your
what's going on.
your recommendations, though, Mr. Kramer, were to if you're here, you wear it at school indoors. If not, you don't. If you choose not to wear it, you need to attend virtually. That was your recommendation, unless an exemption granted.
Right. Yeah, I was just talking. Yeah, that would be.
That's the
for
enforcement mechanism.
Yes.
Left up, and so the building administrator would be left to carry that out.
But I think the daily enforcement also needs to lie within the teacher. And then first is a warning, please, wear your mask appropriately. If I have to ask you a second time, it's an office referral.
So is there any other action items people want to throw on there? Because I personally don't feel like we're making a lot of traction right now. I think we need to, I think some of the stuff we probably need to ponder and see for when we take action on it. It's kind of my thought.
Could it be with the Smart Start Tier 1B, can the district administrators before the meeting take a look at this and provide us a strict strike-through copy of the things that no longer make sense because the orders are not there? This doesn't exist anymore. That WSSA rule isn't there. And provide us a copy of that's what it looks like 24 hours prior to the meeting.
But because we approved this version of the Smart Start plan, how does that change things? I agree 100%. I mean, there's a lot of stuff that's not relevant.
That'd be your modification agenda item right before,
Okay.
where you could take care of those items. Okay. Or any that you see that don't necessarily make sense.
I'll say the one thing that I know never made sense last year was empty the gym and have you stand together huddled up in the commons area while they spray the bleachers in between. I don't know if that was our rule or if that was the WSSA, but I think there's smarter things.
Maybe we were, maybe I was understanding it wrong. But Mr. Kramer, you said on, if we have this meeting, the next action items would include, they would include deciding which exemptions we would allow? Correct. So at that meeting, we would have to have a conversation, one, on what exemptions are there, then we would have to vote on which ones we decide.
You could either separate those out, if that would be the desire, or that could be affiliated with the one large piece with the mask. So I mean, it's completely up to you. You can separate exemptions from the masks on color coding, or you can lump them together and say this is all one. It's perfectly how you feel most comfortable voting upon it, I guess. If you feel you can support exemptions, or you can support masks, but you can't support exemptions, I mean, it allows for some personal opportunity to then take a look at it, but I don't have any preference in lumping it together or separating it. The one thing I did find out, just so everybody's aware in regards to your religious exemption question, the form that exists for the Wyoming Department of Health in regards to vaccination exemptions does require the state health officer's signature to approve. That's for vaccination. That's for vaccinations. Yep. So that you had asked who approved those in that situation. So yeah, there was an individual. I didn't realize that the individual had to be approved.
But we don't know who approves a religious exemption. It's just that you sign it. And
You mean if
Just-
we were to that, yeah, you could set it up in any sense you would like.
So I think those two items should be separate, like, will we allow an action item, allow medical exemptions to K-8 mask mandate, or however that reads. And then another item, allow religious exemptions to that. You can have the discussion in the board meeting around each of those action items that way. But I think it would be great to set it up exactly like that vaccine form reads. That those things are required. We may want to let her know that it's coming the way.
Zach, I don't know if you can give this opinion, but I was just curious on, and you could find out. If you did temperature check every single student upon entering the school, potentially how would that slow down the spread of COVID? Some,
Yeah. And
as much
assume
as
that-
masks or more or less.
I don't know that that's been studied. I don't know that I would be comfortable.
And this is definitely not a scientific piece, but when we discussed it last year, it was the time commitment versus the potential effectiveness and at that time. And Zach would know better than I, and I have not researched this whatsoever, but at that time, the variance of temperatures and what we didn't know, if it was a strong indicator. I mean, I'd asked Dr. Harris how big of an indicator is temperature right now. I don't even know in Delta if that has changed at all. I know taste and smell has dramatically changed in Delta. That has not been something, that's something we absolutely relied on prior to this. And that is something we are no longer hardly relying on whatsoever.
The one thing with temperature is it's easily masked. To Carrie's earlier point, it's you take Tylenol or Motrin, it's going to be normal for 4 to 6 hours, maybe longer. Pharmacists in the room, that's pretty fair.
But what I'm saying, it could help. It could
Yeah, I mean, that's why you do all of those
help some
things.
kids.
And I don't know if numbers were kept. I know for us, we did see numbers change with kids like getting the flu and going to school, getting the flu. Did anybody keep numbers last year as far as kids calling in with
It'd be
those?
completely anecdotal, but yeah, we did not see, just like the community, we did not see flu infection as we had done in previous years. You know, because we did have, I mean, there were times in previous, but last year, that there was 10 to 15% of students gone. And actually, we had, when working with the Department of Health, the county health officials last fall, you know, we were on the cusp of saying anything over 15% absentee rate, we're shutting it down. And we blew past that in a very short time. But in relation to your question, flu is not one of the major reasons that we saw.
I know I did look at one statistic, I can't remember what it was on, it's on the state, I believe, and there was one pediatric death from flu last year in the state of Wyoming, which was drastically lower than a normal year. And I was looking at that this morning.
Have we set a time for this meeting? No, Saturday?
So then this meeting, then we're not gonna allow public comment. We're doing it on Saturday.
I think we have,
I think a lot of public comment.
yeah, we need to allow public comment.
What?
That's only in a day from now. I don't know how happy the public would be about that. We gave them
24 hours notice. right?
We gave them almost a month last time. Now we're going 24 hours. Especially on a Saturday.
So do we just hold it Thursday? I mean, that was the date that most could do it. You know, the concern that I voiced, of course, was, well, is it too late? But maybe next Thursday provides adequate notice. It's a full week. And then you have until the following Monday in order to get whatever you need together if that indeed does pass the board. Take action essentially. It would go into effect essentially 10 days from now.
I think that's a good point, because if you hold it on a Saturday and let's say we do pass a mask mandate, then where's it gonna spread like wildfire, there'll be a lot of, you know, it's like playing the game of telephone. It's gonna be a lot of incorrect messaging. So I think if we have it on a Thursday, we can message out Friday, get people prepared for the next Monday if things do change.
Yeah, I agree with that. I agree. I mean, that's pretty short notice. How do you feel about that? Thursday and then?
Yeah, I mean, a week's better than 24 hours for sure.
It's just, I think that's,
Let's do Thursday.
I agree. Does that work for you though, Mac?
Yep.
So we're saying Thursday, the
Second.
Second,
Based off of how many people came last time, should we have it in the auditorium?
yes.
Yeah.
Is the auditorium bigger than this gym is my question.
I think the sound and the ability for the audience to hear board members is significantly better in the auditorium than it is. I know that was a struggle in that gymnasium.
Okay.
And what time?
6 o'clock.
There's no contest that day or anything.
There's something every day, but let me check. In the fall, as we were trying, and I know you have a yellow slip on your, when you came in of a work session. We tried to avoid as many activities as we possibly could with that, but it does. And that's why we were unable to hit the fourth Tuesday, was because of conflicts with Because of conflicts with activities. I'll check next Thursday quick to see what activities exist. The second, there is a golf at home, volleyball for Lingle, at Lingle, and a junior high football game, Lingle versus Southeast.
Could we do?
But those are 4 o'clock, 4:30. Everything is immediately after the early time. There is no later.
There's no activities on Wednesdays, though, you said.
There are no activities on Wednesdays.
Thursday. What's that?
Oh, I'm good either way.
Stick to Thursday.
Yeah.
Okay.
That box, holding a school board meeting on Wednesdays when we have that in place.
Okay.
So 6 o'clock.
Can we have you read back the agenda? It sounds like we have a date and kind of the outline.
Agenda item number 1 will be modify the smart start plan. Agenda number 2 would be an action item to move tiers from tier 1A to tier 1B. Action item number 3 would be a mass requirement, kindergarten through 8th grade, when county indicators reach, are we gonna go red or orange? I heard on the action at least. I mean, there can of course be further discussion and there can be, but to put it on the agenda to start the discussion, we do need to put a color.
I mean, Dr. Harris, you clarified that orange, not. So that's probably where we should start.
Okay.
That's my opinion.
We can always start it there and it can.
Really, we can always start there and we're in the discussion. You guys can amend.
We're
It just,
getting really good at amending motions.
yes. Then action item number 4 would be medical exemptions. And then action number 5 would be religious exemptions. Correct, public comment. Am I missing anything?
No, I just wish there was a way when public comment exceeds the 5-minute period to interrupt them. That's easier than
What I've been doing.
Chairman Jesperson.
I have an air horn at home.
I think,
Like, is there a countdown timer that we have that it's visible to them? You know, like
I've
you
seen
have in the
some, we
debate.
can probably set up,
coaches.
I've ever
Wrestling
set up,
clocks.
yeah, we can set up a computer screen.
Do the
that have a
debate
countdown.
coaches have one? Because typically you're given,
Were you, no, you weren't debating, were you? Catherine? Were you?
Yes, I
Okay.
was,
Yeah,
yeah.
that's right, you were, okay, did you have the clocks or how did that work? Or did just one person keep it? Yeah, it was stop.
Yeah, they were responsible.
But we could always
for
set
that.
up a computer
But I'm-
screen or a laptop with a countdown that would be large enough.
If you had a screen that you could project a countdown on, that would work. too.
boards, they have a countdown on that. Like my dad told me after the April meeting to not be afraid to use the gavel. So that was just one critique of me. Him having served on the board of Brick County for many years.
use the gavel.
Use the gavel sign.
Hard.
So we can put, and we can talk about it when it gets to that point, what we're gonna do, make sure we stick to 5 minutes. Okay,
What time?
6. Right, well, thank you everyone for your input and for keeping us going the right direction here.
Thank you. Thank you for all the work you did on the slides.
Oh, yeah.
I was gonna mention that, but yeah, that looks Put in some good work.
Can we update that and see it again?
You want me to bring that on that? Okay,
Yes.
I can. Easily retrieved.